Hello, good afternoon, good evening, and good morning to everyone joining our weekly live Q&A on COVID-19. Today, I am pleased to be joined by Dr. Maria Vankakov. Dr. Mike Ryan is on a mission in Uganda as we are responding to Ebola outbreak there. So if you're watching us on Twitter, please use the hashtag AskWHO. If you're watching us on other platforms, please use the comment section to send your questions. And as usual, I will pass them on to Maria. Maria, thank you for finding the time. You're also out of Geneva in Cairo. So thank you for finding the time to join us today.
Thanks, Alex. Good to see you. Just want to check that you can see me because the thing I see says the live is over.
We can see you and hear you very well. So I think all is good. I must be a glitch. Maybe Maria, as we haven't had sessions for a few weeks due to various missions that you and Dr. Mike Ryan were on, maybe we can start with epidemiological update of COVID-19. Are cases increasing and at which rate? How about hospitalizations?
Yeah, thanks, Alex, for having me back again, and sorry for all of the changes in the schedules, and thanks to the viewers who continue to watch this. I'm currently in Cairo, Egypt right now at the regional committee meeting for our Eastern Mediterranean regional offices. So all of the member states from the Eastern Mediterranean region are meeting to discuss the challenges of the region and how they're going to address them. One of those challenges remains COVID-19. So globally, as you know, this is a global pandemic, this is a global situation. So we look at this on all corners of the earth. And we are still seeing a decline in the number of reported cases. And in fact, there's about a 10% decrease in the numbers of cases that were reported to us in the last week. But still almost 3 million cases reported to WHO. We are still seeing some declines, potentially a stabilization in deaths. But last week alone, 9,002 people lost their lives to COVID-19 that we know about. And it's probably a higher number than that. That's really quite a high number and far too high of a number, given we're in the well into the third year of this pandemic. It varies regionally. And if we look, our weekly epidemiologic report will be out either today or tomorrow. But we're still seeing about 1.7 million cases reported in Europe alone. And that's really high. And we're really concerned about that, particularly in the Northern Hemisphere, where we're starting to see influenza circulation in addition to COVID-19. But again, we're just not out of the woods yet. The virus is circulating at an incredibly intense level around the world. And the numbers of cases that are reported to WHO are not really truly reflecting the number of cases that are actually circulating out there. And that's due to the fact that surveillance has changed, testing has changed, and PCR testing has declined around the world while self-testing has increased in some countries, but self-testing is not actually captured in surveillance systems. So we're flying a little blind right now. What we can say with certainty is the virus continues to circulate and the virus continues to change. We'll talk a little bit more about Omicron as this progresses, but Omicron remains dominant and there are many, many sublineages that we're tracking. And deaths continue to increase. And this is what bothers us. This is why we won't stop until the emergency of COVID-19 is over everywhere, because too many people are dying unnecessarily when we have the tools that can prevent that from happening.
Thank you so much, Maria, for that elaborative answer on the epidemiological situation. Still, as much as we are seeing the declines, the rates are quite high. And you mentioned Omicron is dominant, but maybe we can go a bit more into detail on the tracking of the Omicron variant. Are there new subvariants evolving as Omicron has been dominant for a while?
Yeah, so Omicron is dominant, and right now we are tracking more than 300 sublineages of Omicron. We, meaning WHO and all of our technical partners around the world. And why that's important is because the virus continues to evolve, it continues to change, and we need to track that evolution. We need to track each of the changes that are being detected in the countries around the world. BA.5 is one of the sublineages that is circulating, and that is the dominant sublineage around the world. That accounts for about 76% of the sequences that have been shared with open platforms like GISAID, followed by BA.4 descendant lineages, and in particular BA.4.6, which accounts for about 7% of the sublineages that are circulating. And we have a number of BA.2 descendant lineages. Now, what's difficult to answer succinctly is that many sublineages are circulating. And even BA.5, which I said was dominant around the world, there are many sublineages of this sublineage. And it becomes very confusing, I think, to the general public out there when we talk about some of these numbers with these funny combinations of letters and numbers. All of these are Omicron, and all of these have very similar characteristics. The characteristics of Omicron and all of the sublineages are that they are more transmissible than the previous variants that were circulating. We do not see a change in severity of the sublineages of Omicron compared to the ones that were circulating previously, like BA.1 and BA.2. And that's a good sign in a sense that we're not seeing more severe disease. However, this virus, if you are infected and you are not protected, meaning you are not vaccinated or have not received the full number of doses that are required for you, will still kill. Will still put you in hospital and will still kill. And this is what we want to prevent. The good news is that we can prevent that from happening. So we have a lot of sublineages that are circulating. I think in each country, you may hear a new number pop up every day. But I think for the general public, what we want to convey are a few messages. One is that this virus continues to circulate. Two, there are ways in which you can protect yourself. When you are out and about, when you are out around others, you can wear a mask. You can keep yourself distanced from others as much as realistic as where you are, where you live, where you work, how you travel. You can make sure that you are vaccinated. And not just you are vaccinated, but your loved ones are, particularly those who are most vulnerable. Anyone over the age of 60, people with underlying conditions, people who are immunosuppressed, and really critically our frontline workers. And this will protect people going forward. There are other investments that need to be made in terms of our workforce and make sure that our workforce in the health facilities are well protected with personal protective equipment. Make sure that we invest in ventilation where we live, where we work, where we study. All of these things are required to fight against any of the sublineages. This virus, as it circulates, will cause further waves of infection, but those waves of infection do not need to lead to further waves of death. And I think that's one of the positive messages we want to put out there, but our work is not done. We can't just pretend that it's over. We still have to be vigilant, and we still have to work hard to reduce the spread as well as prevent severe disease and death.
Thank you so much, Maria. And speaking about tracing the variants and the virus at all. A few of our viewers are mentioning the testing capacities. So do you think that due to lack of testing or decrease in testing around the world and surveillance efforts, that we may be at risk of missing the detection of some new variants?
That's a great question. We are currently quite concerned about our ability to track the known variants. So all of these sublineages of Omicron, more than 300 of them, as I mentioned previously, and any new sublineage or any new variant that may emerge. The way that we are able to track these viruses and track these variants is through surveillance activities, through the testing of patients, whether you're using PCR-based tests in labs or self-tests, and the sequencing that comes from that. The sequencing of SARS-CoV-2, the virus that causes COVID-19, the number of sequences has dropped about 90% since the beginning of this year. And that means our ability to use data from around the world to look at what is circulating, what are the variants that are being detected. The analysis by which we can study each of these variants is diminished. We work with technical advisory groups around the world to be able to assess available information about each of these sublineages, about its transmission, about severity, about the impact on our diagnostics, our therapeutics, our vaccines. And that data that is available around the world is diminishing. And that limits our ability to track and trace and assess in real time. So that's what we're concerned about. We're asking governments to maintain and enhance surveillance for SARS-CoV-2, particularly as we're starting to see an increase in cases. In many countries, right now, they're entering the colder months. And in colder months, people spend more time together indoors. The virus loves this kind of activity. It can circulate very easily amongst people who are in close contact with one another, particularly in areas where there's poor ventilation. And we need to be able to look at the transmission. We need to look at the vulnerable groups so that we can look if there's any changes in the virus. but our ability right now is reducing. So governments need to maintain surveillance, including sequencing, share those sequences with the world so that they can be assessed, continue to research this virus. Unfortunately, it's just not quite over yet.
Thank you so much, Maria. I'm seeing here that some of our viewers are watching us on Facebook, writing comments that people with flu and cold, as you rightly said, the colder weather is coming to the northern hemisphere, and they are not testing, assuming it's not COVID. So, what would be your advice for people who have any symptoms similar to COVID to do and where to get tested?
So that's a good question because we are seeing co-circulation and circulation of other viruses, other respiratory viruses like influenza. If you remember, because the world, I mean, everybody remembers the world really largely shut down for quite a long time. People were not mixing. And influenza didn't really circulate for more than a year, almost 2 years. Flu is starting to circulate again. So it's really important if you are in a risk group for influenza, for severe disease for influenza, that you get vaccinated. So follow your national programs for flu vaccinations. Really, really critical that you get that flu vaccine. Also get your COVID vaccine and follow the national recommendations about the number of doses that are required for you. It depends. It depends on your age, your underlying conditions, the availability of vaccines in your country. So follow those national recommendations. If you're feeling unwell, it's important that you seek your care through your medical provider. It also depends on your age and your underlying factors. Always reach out to your medical professionals if you have any questions. But it's very difficult to distinguish symptoms from flu and from COVID and other respiratory diseases because the spectrum of disease ranges from no symptoms at all for both flu and influenza all the way to severe disease and death. So it really does depend. But if you are concerned, make sure you seek care through your healthcare provider. And the good news with COVID-19 is that there are antivirals that you can use. If you are detected quickly, you can be put on a regimen of antivirals, and that will help prevent developing severe disease. So there's a lot of amazing tools that are out there, but we need good testing. We need quick and accurate clinical care provided by our trained and our wonderful healthcare workers that are out there.
Thank you so much, Maria. We have a question from Omar Sabri, who is asking whether the PCR tests detect Omicron.
They do. So our tests, the PCR test and the self-test, the antigen rapid diagnostic test, are working very well against Omicron. It does depend on when you're sampled during the course of your infection in terms of the ability of the test to detect the virus itself, but they're holding up very well. They work very well.
Thank you so much, Maria. We have a question from Desiree Teal watching us on Facebook. Should you take the flu and the COVID vaccine at the same time?
So that's a great question that we get quite a lot. And again, I will say it depends on you. It depends on your factors and whether or not you can have them at the same time. Seek advice from your medical provider if you are concerned. If it is recommended in your country that you can have both at the same time, then it's fine. What is important that people get vaccinated. And you get vaccinated when it's your turn. You get the full number of doses that are recommended for you. One of the other big concerns we have, Alex, right now, when we look at vaccination coverage, now I'm talking about COVID-19 vaccination coverage around the world, there are incredible numbers that are out there, with maybe in some countries we have 80% of the population or 90% of the population vaccinated. In some countries, that's as low as 10% or even less than that. And I would remind you that almost 3 years into this pandemic, 32%, around 30% of the world's population has not received a single dose of COVID-19 vaccine. That means that we're missing huge proportions of the population. And when we look at who is missed, our biggest concern right now are people who are vulnerable for developing severe disease. We want to reach 100% of people over 60 in every country, 100% of people with underlying conditions in every country, and 100% of our healthcare workers in every country. We have not reached those targets. If we look at it by region, there is huge discrepancy in vaccination coverage of the most at risk of our healthcare workers, particularly in low-income countries. And we all have to fight for vaccine equity, vaccine use in all of these countries. It's really a significant concern for us because as this virus circulates, those who are not vaccinated are at a greater risk of needing hospitalization and of dying. And there's a lot that we can do to prevent that from happening. So that's why we're so passionate about this.
Thank you so much, Maria. We have a question about accessibility to therapeutics. A viewer from Canada was saying that that seems that they are not accessible to everyone. So maybe you can tell a bit more about the access to therapeutics and our efforts to make them in an equitable manner.
Yeah, this is also a really good question. So it's not only important that we identify therapeutics that work, that are safe and effective for either preventing severe disease or preventing death. They have to be affordable and they have to be accessible. And unfortunately, we don't have enough antivirals around the world reaching the people who need them most. So the antivirals that are on the market that are recommended by WHO are recommended for people who are at risk for developing severe disease. So people over the age of 60, people with underlying conditions. And they need to be administered early in the course of their disease so that they prevent that disease from progressing to severe disease. Access to these antivirals is not the same around the world. And that's what we are really trying to work with all of our partners through the ACT Accelerator, with many different partners to work on price, to make sure that the manufacturers are selling these at a fair and decent price so that countries can purchase them. We're not talking about charity here, we're talking about access. And this remains a significant challenge for us as we go forward.
Thank you, Maria. We have a question as well on therapeutics from Shell Goldstein, who is asking, are new therapeutics being developed?
There are many new therapeutics that are being developed that are in the pipeline for assessment. Through our clinical management team led by Dr. Janet Diaz, she is leading a working group through our guideline development groups that are assessing several different therapeutics that are in the pipeline. And the way that they assess these therapeutics is they need to look at the available data from studies around the world, pull that data together to assess whether these are safe and effective, and if they are safe and effective, who they are most beneficial for. We have these living guidelines that we have issued. We're in our 11th or 12th version of this published online. These guidelines are continuously revised and assessed. And each time a new therapeutic is recommended or not, it's issued in our guidelines. But I think the other point to mention is that we still need research and development for therapeutics. We still need further research and development for vaccines, this next generation of vaccines, not only ones that prevent severe disease and death, which is what they are intended for, but also there are several vaccines that are in development that are looking at preventing infection and preventing transmission. This would be a game changer. If we could actually reduce the amount of spread of this virus with the use of a vaccine. The current vaccines actually do a pretty good job, but that's not what they are originally intended for. The vaccines that are on the market right now are focusing on preventing severe disease, and they're incredibly effective at doing this even against Omicron and all of the sublineages that are circulating. But more R&D is needed. We need more innovation and R&D on personal protective equipment. Most of the personal protective equipment that's out there is single use. It's developed for men's bodies, and most of the healthcare that's delivered is delivered by women. We need more innovation in this area, and there's a lot of good work that's out there, but it needs to be nurtured, it needs to be invested in. And lastly, we need research on post-COVID-19 condition. So this is something that we are looking at. We are working with partners around the world, but we need investment to study this and to develop better rehabilitation, better management for people who are suffering from post-COVID-19. So again, there's a lot more work that needs to be done. We're 2.5 years into this. We don't have a lot of knowledge in terms of the length of knowledge that we have for this. And this virus will be with us. So we need to continue to study this, and we need investment, continued sustained investment in the response, but also in research and development so that we can be better each time we see a new wave of infection.
Thank you so much, Maria. There are a few questions or comments I'm seeing here about vaccines, efficacy, and safety. So maybe you can clarify once again that vaccines are safe and how we know that, but also whether vaccines are protecting against infection or against the severe disease.
So I'll start with the first part of that question. So there are many vaccines, safe and effective vaccines that are now approved for COVID-19, and they remain incredibly effective at preventing severe disease and death. And I think that's really important. This is based on studies, many studies with people around the world that are looking, not only do they work, do they prevent you from needing hospitalization? Do they prevent you from dying? But also looking at the side effects. Of course, there's always risks in any type of vaccine or any type of therapeutic, but this is being assessed in every country around the world at a global level. And you have to look at what the risk is. What is your risk of developing severe disease? What is your risk of dying from infection with this virus versus what is your risk from vaccination? And the vaccines that are on the market are proving to be incredibly safe and effective. And this is based on many, many studies around the world and many people who are specifically looking at adverse events. Now, the vaccines that are currently on the market, many are developed with the ancestral strain, the original virus that was circulating. There are some bivalent vaccines that are out there. You may have seen in the news that some of them include part of Omicron, BA.2 or BA.4 or BA.5. These are being developed, and I think what we have to inform everyone is that as this virus is here to stay, we do see that the vaccines prevent against severe disease and death, but they don't sustain prevention against infection. So that's why we're seeing people get reinfected or people who are vaccinated getting infected. And I think that is to be expected. So the longer the virus circulates, we may need to have more boosters or more additional doses as time goes on. But again, there are so many people around the world that have not even received their primary series. This remains our critical focus around the world. Those who are most at risk, over 60, people with underlying conditions, our frontline workers need to be vaccinated with their primary series first before we start boosting and boosting and boosting others who are well protected with the doses that they already have.
Thank you so much, Maria. We are receiving quite a lot of good questions. Here is one on how long immunity against Omicron lasts.
Very good question. So I keep saying this after all of the questions that we've received today. So this is currently being studied. Let's go back a little bit in time and look at when vaccines started coming onto the market. It was really after the first year. It's pretty incredible that it took a year to develop these safe and effective vaccines. And at the start of 2021 and into 2022, global vaccination efforts were underway. And so people are being followed over time. We, with partners from Canada, just published a study. It came out in preprint looking at immunity over time and looking at different types of people, people who have had infection only, people that have been vaccinated, and people that have been both vaccinated and been infected, and looking at the duration of that immune response over time. What we found in that study is that the duration of protection against severe disease and death was maintained for more than a year. And in fact, I think 15 months was the longest we were able to follow people up. Now, prevention against infection reduces very quickly over time, which is why you've heard us say many times this vaccines and not vaccines only strategy. We still have to take measures to protect ourselves against infection so that we don't pass the virus to others and that we don't increase our risk of developing severe disease, even if we are vaccinated. So again, it depends. I'm sorry, Alex. I think I give these really, really long-winded answer. And if I could answer something very quickly, I think every answer of mine would be, it depends, which is unsatisfactory, I know, to the viewer, but it's quite complicated because it's dependent upon many factors. I do want the viewers to know out there that there are many studies that are underway that are looking at immunity, looking at hybrid immunity from people who have been both vaccinated and infected. I think the latest numbers of the reported number of infections around the world is more than 600 million, but it's likely that there are billions of people that have been infected. They're just not captured through the current surveillance systems or even the past surveillance systems. So this is something that needs to be studied. But the vaccines are holding up very well and over long duration of preventing severe disease and death. Those of you who are watching saying, what do I need a booster or not? Follow your local recommendations. If you are recommended to get a booster, if you're in a group that is at risk for developing severe disease and you're recommended to get your booster, please don't wait. Please get that booster when it is recommended for you.
Thank you so much, Maria. We also had a question earlier on the chat from our viewers. How long does the incubation period with Omicron last?
So the incubation period seems to be declining with each of the different variants of concern that are being detected. There was a study I'm failing to remember which journal it was published, but it was a review that was looking at the incubation period over time of the different variants. This is the fifth variant of concern that we've been tracking over time, and it seems to be reduced. It seems to be getting the number seems to be getting lower. And I think that is really quite interesting. If we look at this virus is changing. This virus is finding ways to adapt to infect more people. When we look at transmissibility, we look at some intrinsic factors within the virus itself, particularly some of the mutations in the spike protein. And in fact, many of the subvariants that we are tracking seem to have some similar mutations. And there are many in the field that are looking at this as potentially seeing some convergent evolution of finding these particular mutations that are relevant and common amongst many of the subvariants. But we also look at immune escape, and we also look at the ability of these viruses to continue to infect even people who have been infected previously. So it is quite a complicated thing. Again, this is a good question that points out we need to study the basic epidemiology of each of these variants. What is the reproduction number? What is the incubation period? And look at transmission factors. Is there any change in the way that this virus transmits to others? Do our countermeasures, our public health and social measures continue to work? They do. That's why we're asking people to continue to wear a mask and to keep yourself safe, get vaccinated, distance, improve ventilation, etc.
Thank you so much, Maria. We have a next question from Pratar Shil watching us on LinkedIn. Does WHO have any directions for the employers regarding precautions?
Say that again, Alex.
Does WHO have any directions for the employers in regards to precautions?
In regards to what?
Precautionary measures in workplaces. Yes.
Sorry, I think my connection isn't great. Yes, we do, in fact. So we have issued guidance since the beginning of this pandemic for different types of settings. First, starting in healthcare facilities, where there were health workers caring for patients with severe disease. But we've expanded that guidance throughout the pandemic and updated this regularly, looking at different types of businesses, looking at schools. We've worked with the hotel and tourism industry to make recommendations. A lot of this factors around the type of setting indoors. We know that this virus thrives in indoor spaces, and particularly where there's poor ventilations, passing through the air with droplets and with aerosol, these tiny infectious particles that you can't even see with your eye. It is facilitated. Transmission is facilitated when you're indoors and ventilation is really poor. So our ventilation guidance for different types of facilities and different types of buildings is really quite extensive online. And we've been working with a great group of international experts in many different disciplines around the world to improve that guidance over time. So we do have a lot of guidance that's out there for businesses. And there's ways businesses can open. So many businesses are open now. We're not asking anyone to really change their lives now. Because we have so many different tools, we can live our lives safely. We could live with COVID responsibly while we go about our daily life, but we take some simple measures to keep ourselves safe.
Thank you so much, Maria. Maybe a few more questions just before we close. As we see flu starting to circulate, is it possible to be infected with COVID and flu at the same time?
It is. We have seen some examples of people who are infected with both SARS-CoV-2 and influenza. Now, as both of these viruses circulate, it is possible that we may see more infections or co-infections with both of these viruses. The measures that were put in place for COVID-19 are also protective against flu. So a lot of the measures that you've heard, vaccinate against COVID-19, but vaccinate also against influenza. Wear a mask, distance while you can, stay home if you're unwell. And it's important that there's policies in countries that support people to work from home or to take sick leave if they need to. And make sure you limit your contact with others. These viruses spread in similar ways, so it's important that you follow all of those measures to protect yourself against COVID-19, but also for influenza.
Thank you, Maria. And speaking of measures, we are having some questions about ventilation. So maybe you can stress the importance of ventilation in COVID risk reduction.
Yeah, so ventilation is one of the many measures that need to be addressed to prevent transmission. And this requires investment. I mean, there are some simple things that people can do. Spend more time outdoors than indoors if you can. And that's easier to do in warmer weather or better weather than not. In some situations, you can open the windows and have good cross ventilation in the rooms that you're in. And in some situations, there needs to be an investment in ventilation in buildings. We've issued some pretty comprehensive guidance on this. We did since the beginning of the pandemic, but that guidance on ventilation has grown. It's been expanded over time to cover many different types of buildings. It's been expanded to cover more details within the guidance itself, and that's something that we are constantly looking at. But ventilation is one of the many measures that needs to be invested in, and we're not really seeing that investment around the world. I think it will not just improve for your health from COVID, but for other contaminants that circulate through the air.
Thank you so much, Maria. And maybe two more questions before we close. As immunity increases, we've seen that COVID waves led to less hospitalizations and less deaths in comparison to earlier days in the pandemic. Do you think that this trend is likely to continue?
I certainly hope so. And it should. As population level immunity increases around the world, we should continue to see a reduction in severe disease. Now, two caveats to that. One is that we have to vaccinate those most at risk. The people that are being hospitalized in every country, low income, high income, middle income, north, south, east, and west, are people who are not vaccinated or not fully vaccinated. They haven't received the number of doses that are recommended for them. This is critical to fix in all countries. And secondly, we have some uncertainty with the virus itself. As the virus continues to circulate, the more opportunities it has to change. And we don't know for sure what the characteristics of those future variants will be. We do know that we do expect there to be more variants that will be detected. We expect that those variants will be more transmissible because they will need to outcompete whatever is circulating out there. We expect that more variants will have some properties of immune escape, which may mean that our vaccines don't work as well as they do now, which would require additional doses as we go forward in the months and years to come. And we don't know if the next variant of concern will be more or less severe. As I mentioned, with all of the subvariants that we are tracking from Omicron, we do not see a change in severity. So we aren't seeing more severe disease amongst people who are infected with these subvariants. But the next one could be different. So we have to remain vigilant. And I think, Alex, I just want to leave like one key message here. Those of you who are watching, we want you to be safe. We want you to live your lives as safely as possible. It's people like us, like me, people who work in ministries of health in the different sectors across governments to maintain vigilance for this virus, because we have to keep a very close eye on what's going to transcend over the next months to years. We cannot let our guard down because the virus will not allow us to do so. But there are ways we can live our lives safely. We get vaccinated, we wear our masks, we improve ventilation, we know what our risk is, and we take steps to lower our risk while we live our lives safely.
Thank you, Maria. And we had questions from viewers. When is this virus going to end? And actually, do you have a model to end this virus?
So the virus is here to stay with us. The questions that we are trying to ask is, how do we end this emergency in every country? How do we end unnecessary deaths in country using the tools that we have? Our goal that we laid out in the latest global strategic preparedness and response plan was to end the emergency of COVID by the end of this year. We're not quite there yet. Some countries are able to manage COVID as a disease where they are minimizing deaths, but there are far too many people dying. I mentioned more than 9,000 people died last week alone. And there's a lot that we can do to prevent this. So the virus is here to stay with us. We have to live with it responsibly. We're not quite there yet. And the pandemic itself will end, but it's just not over yet.
Thank you so much, Maria, for your time today. And I thank to all our viewers for their questions. I'm not sure we addressed them all, but we will continue next week as usual. So thank you for watching us from Pakistan, Cameroon, Senegal, Yemen, Zimbabwe, Mexico, Colombia, Dominican Republic, Rwanda, Thailand, Guatemala, Vietnam, India, Ethiopia, the US, Kenya, Serbia, Nigeria, Mali, Poland, and many others. Thank you for staying with us, and I wish you a good rest of the day and rest